My name is Terry. I've been doing dental hygiene for 31 years. I've heard of the Isolite for years and I was very interested in using it. I've talked to several hygienists that have used it and they've all seemed to think it's a good addition to the practice. The first time I used it, I was a little nervous because my patient had a very small mouth, very small opening. I used the small mouthpiece, folded it like the instructions told me to, and it worked out perfectly. It fit right around the back of his last molar and we were able to do the procedure in half the time. The nice thing was that I wasn't using the suction. I wasn't constantly picking up the saliva ejector. I had direct vision all the time. I did have to switch it over to the other side, but that wasn't a problem. It worked wonderfully. The first time I used it, I had it positioned too anteriorly, and I felt like I was looking over the handpiece. Second time I used it, I just repositioned it a little farther back. I didn't even notice that it was in my way. After using the Isolite for the last 2 months, I don't know how I worked without it. It's cut my debridement and root planing time in half. I saved time by not having to reach for the suction or readjust my light. The only hurdle I had was my own intimidation of placing the mouthpiece, but after 2 or 3 patients, that was no longer an issue. The Isolite has definitely made my job easier and less stressful. It's more pleasant for my patient and also for myself. It's great for using with the ultrasonic. I'm able to use my mirror instead of using the suction all the time. I can see better and it goes a lot faster.
Well, the Isolite was a new experience for me. I've never had it done before, and this took a little getting used to because of a little larger apparatus in my mouth, but once I became comfortable with it, it was an excellent experience. It cut the time of the cleaning in half and allowed me as a patient to control the drainage of excess liquid much easier. So all in all, I loved the product.